Hi, everyone. It's 10:30. We're going to give just another minute or two for folks to continue to join, and then we'll get started. All right. Well, good morning. I am Sarah Altheger. I'm the managing editor of the Soy Connection newsletter, and I want to thank you all for joining us today for our webinar to discuss the most recent issue of Soy Connection newsletter featuring information on fertility. So I want to get started with just a few housekeeping items. Our webinar today will be about 45 minutes long. We will have time for questions.
Again, with these follow-up findings published 1 year later, the researchers were focusing on the potential anti-cancer effects of soy, not discussing fertility. So let's look at this follow-up research. So we have 4 different diets. Again, the women were housed in a metabolic ward. The first diet, textured vegetable protein, 60 grams per day. These are the results from the study from 1994. They also published them in their follow-up study. Then you have a miso diet, which led to an increase in follicular phase length, 19 versus 16 days. And in this case, the IF refers to milligrams of isoflavone, so 25 milligrams of isoflavones. In the third diet, women consumed 60 grams of soy, just like they did in the first diet, but there was no effect on follicular phase length. But you'll note that in that third diet, the soy lacked isoflavone. So this shows that isoflavones are responsible for the effects on the menstrual cycle. And then finally, in the fourth diet, the women consumed half the dose of TVP that they did in the first diet and half the level of isoflavones. But what's interesting is that you see in response to miso an increase in follicular phase length, 16 to 19, whereas there was no change in response to textured vegetable protein, even though the isoflavone content of those diets were the same. And this suggests that unconjugated isoflavones may be more biologically active than conjugated isoflavones. So let me explain that point for a minute. In soybeans and unfermented soy foods such as edamame, soy nuts, soy milk, tofu, the isoflavones are found attached to a glucose molecule. So they're referred to as being in the glycoside form. For the isoflavones to be absorbed, your body has to hydrolyze the glucose off, and then it can absorb the isoflavones. When you consume fermented foods, because of the process of fermentation, the glucose is already split off, and so you're consuming foods that contain isoflavones without the glucose in aglycone form. And there's some evidence to suggest that when isoflavones are present without the sugar, they're absorbed much more quickly, and so they may act somewhat differently than isoflavones that have the glucose molecule attached. Very speculative, but that is one difference between fermented and unfermented foods. Let's fast forward more than a decade to look at a meta-analysis that evaluated the effects of soy on hormone levels in premenopausal women. The overall conclusion, the clinical implication of these relatively modest hormonal changes are unclear. So let's look a little bit more specifically. I've tried to present the results in very simplified form. We have the results for premenopausal women. The study, just for your information, the meta-analysis also looked at postmenopausal women, but that's not relevant to the issue of fertility. So there was no effect on estradiol levels, 11 studies, 250 women, but you do see that follicle stimulating hormone and luteinizing hormone levels were decreased about 20–25% or so. That was barely statistically significant, but you do see this decrease. Now, menstrual cycle length was only increased about 1 day. So we're not seeing, based on 10 studies, the large increases in menstrual cycle length that we saw in those first 2 studies by Cassidy and colleagues. And to be honest, I'm not even convinced that soy affects luteinizing hormone levels and follicle stimulating hormone levels. And the reason I say that is because in the case of these 2 hormones, there were only 73 women evaluated in the 7 studies. So they were very small studies, obviously. So 73 women in total. In 2012, subsequent to the publish of that meta-analysis, Kahn and colleagues looked at the effects of isoflavones on breast cell proliferation. They did not find an effect on cell proliferation, so that was an argument in support of the safety of isoflavones. But they also looked at follicle stimulating hormone levels. And you can see in this case, there were 98 women involved in this study, more than the combined amount of women involved in the 7 studies in the meta-analysis, and there was no effect whatsoever on follicle stimulating hormone levels. And bear in mind that the women in this study consumed 235 milligrams of isoflavones per day. So 5 or 6 times more isoflavones than typically consumed in Japan, and yet you still see no effect on follicle stimulating hormone levels. They did not look at luteinizing hormone levels in this study. So just in sort of to summarize what we've discussed so far, soy may slightly decrease FSH and LH levels, although I'm doubtful of that, and may modestly increase menstrual cycle length, follicular phase length, the first 2 weeks of the cycle, but ovulation is not prevented. So before moving on to male fertility, I want to discuss one very intriguing study. It's just one study, not possible to reach any definitive conclusion, but the findings are actually quite exciting. This was a cross-sectional study, epidemiologic study, that concluded soy food intake may protect against the adverse reproductive effects of BPA, bisphenol A. Now, bisphenol A is classified as an endocrine disruptor. It's a chemical produced in large quantities for use primarily in the production of plastics and epoxy resins. So here we have the general makeup of the study, 239 women. They were undergoing assisted reproduction, and in total there were 347 in vitro fertilization cycles. And the researchers were looking at the probability of having a live birth per initiated cycle. Down at the bottom, you have quartiles of urinary BPA concentrations. So as you go from quartile 1 to quartile 4, that indicates women were exposed to higher amounts of this endocrine disruptor. And then you'll see now that as exposure increased, the likelihood of having a live birth, decreased quite dramatically, and that trend was very statistically significant. So BPA exposure was reducing the likelihood of women having a live birth. And these findings applied to women who did not consume any soy. However, of the women in this study that consumed soy, there was no relationship between BPA exposure and the probability of a live birth. So it appears from this one preliminary study that soy was negating the harmful effects of BPA on reproduction. Now let's take a look at male fertility. And there's no question that this topic rose to the forefront of consumer consciousness, and I think even awareness within the health professional community as a result of a 2009 article in Men's Health that focused on soy, and it basically concluded that this is the most dangerous food for men to consume. You can see the quotation here, but there may be a hidden dark side to soy, one that has the power to undermine everything it means to be male. That certainly is quite a statement. Now, the article did not quote many well-known soy experts. They did cite a few studies that I want to share with you, and then I'll come back to that article at the end of the presentation. So in 2003, there was a small study that found soy supplements reduced serum testosterone levels. Now, the decrease was only 6%, and importantly, they actually reached statistical significance when they compared the final values in the soy group to the baseline values. They did not compare soy to the control group. Even though there was a control group, they didn't report the data for the control group, which to my mind is inappropriate statistically. And again, there was only a 6% decrease, and it was in response to 120 milligrams of isoflavones per day. That's about 3 times typical intake among Japanese men. Now in 2007, another small study, 19 men, did find a decrease in testosterone levels. In this case, the men consumed 56 grams of soy protein per day. They didn't provide data on isoflavone content, but average soy protein intake in Japan is about 10 grams per day. Obviously, the average American male consumes about 90 grams of protein per day. So this was a huge amount of soy protein, much more than anyone should consume. But what really, I think, made the article and what attracted so many people to this topic was the discussion of a case report that was published in 2008, in which a 60-year-old man developed gynecomastia, which is breast development in men, a small amount of breast development, allegedly in response to his consumption of soy products. So this is describing a single individual. What was not mentioned in the article, and also subsequently overlooked by much of the coverage, media coverage that followed this case report, was that this individual was consuming 12 cups of soy milk per day that provided 360 milligrams of isoflavones, 9 times typical intake in Japan. Furthermore, if you assume that a cup of soy milk has about 110 calories perhaps, it's very clear that this person was probably getting 2/3 of their total caloric intake from soy, which suggests that the diet not only was unbalanced, but perhaps even nutrient deficient. So I don't think you can learn very much from this type of case report, other than that consuming excessive amounts of any single food can be problematic. In 2010, a meta-analysis addressed the issue of whether soy affects reproductive hormone levels in men. The conclusion: neither soy foods nor isoflavone supplements alter measures of bioavailable testosterone concentrations in men. Bioavailable testosterone is the biologically active form of testosterone. And this is a meta-analysis of the clinical studies. And this is a very busy chart. It provides the data from that meta-analysis. So I'm just going to focus your attention on the yellow rows. You can see for total testosterone, 32 treatment groups, so it's a large data set. And then you look at the p-value, 0.49. You know, traditionally 0.05 is used as the value for determining statistical significance. So this was not even close to statistically significant. If you look at free testosterone, the biologically active form, 13 groups, again, 0.85. No evidence at all of any kind of effects on testosterone levels. Now, I'd like to present some unpublished data. It's now a decade after that meta-analysis was published, so the analysis is being updated. So bear in mind, these data have not been published yet. And again, a very busy chart, so I'll just focus your attention on the yellow rows. Now we have 43 groups looking at total testosterone, p-value 0.86, not close to statistically significant. Unbound or biologically active testosterone, 17 groups, p-value 0.07. So the clinical studies, these are all clinical studies, are very clear. Soy does not lower testosterone levels, even in response to very high amounts of isoflavones in soy. Now in 2010, I published a narrative review that looked at the effect of soy and isoflavone exposure on a host of indicators representative of possible feminizing effects. And as you can see here, the conclusion: what isoflavones do not exert feminizing effects on men at intake levels equal to and even considerably higher than are typical for Asian males. I also concluded that there is essentially no evidence from the 9 identified clinical studies that isoflavone exposure affects circulating estrogen levels in men. Estrogen is actually considered to be a male reproductive hormone as well as a female. And interestingly, older men actually make more estrogen than older women do, because men convert the testosterone they make into estrogen, whereas in older women, ovaries have largely stopped producing estrogen. But again, this is a narrative review. I did not apply statistics to the 9 studies that evaluated estrogen levels. Well, in the updated analysis, we have now done that. And again, focus your attention on the yellow rows. There's no effect of on estradiol, the p-value 0.47, 26 groups, large data set. Estradiol is the most potent of the estrogens. Same thing with estrone, only 8 groups, but p-value 0.24, very, very far removed from statistical significance. Now, I mentioned the importance of that case report in terms of drawing attention to the possible feminizing effects of soy. And I was only able to identify one study, one clinical study, randomized clinical trial that actually looked at whether isoflavones have an effect on breast tissue in men. It's an important study because the men consumed 100 milligrams of isoflavones per day. So they were at the very high end of the dietary range. And it was a very long study, 36 months. That's a very long time for a nutrition clinical study. And you can see no effect on breast symptoms. That's tenderness, which during gynecomastia, tenderness would be increased. No effect on swelling or enlargement. No difference between isoflavones and placebo. And there were 300 men in this study. Just to finish up, I want to talk a little bit about soy and sperm concentration and count. That topic garnered attention as a result of a publication in 2008 that found higher intake of soy foods and soy isoflavones is associated with lower sperm concentration. Now, I think this study drew a lot of attention in part because it was published by Harvard researchers, and it was the first of its kind to be published. It's a cross-sectional study. It's not a clinical study. So this involved 99 men who were partners, part of a couples who attended an infertility clinic. And you can see the investigators divided the men into 4 groups according to the number of servings they consumed per day. Now, not surprisingly, soy intake was very low among these 99 men. You know, I've been of the opinion for 20 years that epidemiologic studies or observational studies involving the general population of non-Asian countries really can't provide any meaningful insight into the health effects of soy, because soy consumption is just too low to exert a biological effect. You can find associations, both good and bad, but I don't think there's a causal basis for them. So here we see in the highest intake group, men only consumed about 1/2 serving of soy per day. Then you see the sperm concentration was 72 million per milliliter in the high soy consumers versus 106 in the men who did not consume soy. Now that difference was statistically significant, but bear in mind anything above 20 million is considered to be within the normal range for sperm concentration. So these men, although they had slightly lower sperm concentration, were not in danger of infertility. Furthermore, and this is a point often overlooked, is that much of the reason that sperm concentration was decreased was because men in the high soy consuming group actually had a larger ejaculate volume. And I don't think there's any reason, causal basis for thinking that soy can increase ejaculate volume. And when you actually look at total sperm concentration, there was hardly any difference among the groups. And in fact, there were no statistically significant difference between the no soy consumers and the high soy consumers. So again, this study does not bother me in the least, especially because when you're going to address a question like this, you really need to base your conclusions on the clinical data. And 3 clinical studies, intervention studies, controlled studies have evaluated the effects of soy and soy isoflavone exposure on sperm and semen parameters in young men. I've just summarized the data. You see in the first column the author, then the number of men in each of the 3 studies, the age of the men, the length of the study went from 2 months to about 3 months, and then the dose of isoflavones, 40 milligrams in the study by Mitchell, about 1.5 servings of soy per day. Next study was about 2.5 servings per day. And then the third study used supplements, huge amounts of isoflavones, up to 480 milligrams per day. No effects on ejaculate volume, sperm concentration, sperm count, sperm motility, or sperm morphology. And interestingly, those Harvard researchers that published that paper in 2008 showing lower sperm concentration did somewhat of a follow-up study. And just briefly, I'll say that they found that soy food intake in men was not related to clinical outcomes among couples presenting at an infertility clinic. So the likelihood of a woman having a child was unrelated to whether her partner was consuming soy. And then just one more case report I want to discuss. Again, it's a single individual, but it's intriguing because I think this case report is often not cited in the literature. These individuals, Italian research, concluded that isoflavones may actually be a treatment for oligospermia, which is low sperm count. In this case, they were dealing with an individual, a male of a couple who was unable to conceive a child. They were attending a fertility clinic. Turned out the male had low sperm concentration. He consumed 80 milligrams of isoflavones daily. That's about 3 servings of soy, but it was in supplement form, 80 milligrams per day. After 3 months and after 6 months, sperm count increased and was normalized, and the couple was eventually able to have a child. So it's interesting when you actually look at the data, there's some suggestion that soy could actually normalize sperm count in men with oligospermia. And then I do want to get back to the Men's Health article. As I mentioned, this is the article that really started the concern about male feminization and male infertility. In 2015, they noted in an article on plant-based milks that soy contains phytoestrogens, plant-based hormones that may in excess lead to dips in testosterone. Up to 4 servings a day, however, shouldn't hurt. Well, it would have been nice if they had included that statement in their original article, because no one should be consuming more than 4 servings of soy per day. And in many respects, they went a step further in 2019 when they were discussing tofu as the new king of protein. And they said, what about low sperm count in man boobs? Several news outlets, including this one, Are Bad, may have overblown those findings. Thank you very much for your attention.
Thank you, Mark. We appreciate you sharing that in-depth look at the evidence surrounding soy in male and female fertility. So now we're going to shift over to a few questions. And again, if you'd like to submit a question, if you click on the Q&A icon at the bottom of your Zoom window, you'll be able to type in some questions there. So Mark, we do have a couple questions coming in. The first one is, are there any in utero effects of maternal soy consumption?
Yeah, that's a really good question, because that's not related to fertility per se, but it is an important issue nonetheless. And there's 2 responses to that. One, a study in the year 2000 suggested that soy consumption might increase hypospadias in male offspring, which is a sort of a male-formed penis. And the subsequently published work has refuted that finding, especially a Japanese study, which was very large in size. And of course, in Japan, they consume large amounts of isoflavone, so it's a good group to study. The study published in 2000 involved British individuals, so soy consumption was very low. And also I'll point out that there were only 51, of the 6,000 women in the study, there were only 51 babies with hypospadias. And also they actually found that the consumption of non-soy legumes was more associated with hypospadias than was soy foods, and the non-soy legumes, the other beans, really don't contain significant amounts or nutritionally relevant amounts of isoflavones. So even their own internal findings did not suggest that isoflavones were problematic. The other point is that, and this is a little bit more speculative, worthy of some discussion certainly, is that in utero, the fetus is exposed to very, very high estrogen levels. And it's very unlikely, in my opinion, that the isoflavones, because they are so much less potent than estrogen, are likely to have an effect on the fetus when it's often said that the fetus is actually swimming in a sea of estrogen.
Okay, thanks, Mark. Second question. As a breast cancer survivor who always thought I could not consume soy, but am I correct now that it is okay to consume soy?
Well, I will tell you what the data are. The controversy started in the late 1990s as a result of animal studies published from the University of Illinois, and they've continued to publish a couple of studies a year, just tweaking their model ever so slightly. And they did find that the isoflavone stimulated the growth of existing mammary tumors in these mice who had no ovaries and who were immune deficient. It wasn't until about a decade later that the population studies actually found that consuming soy after diagnosis of breast cancer is associated with a decrease in risk of recurrence and an increase in breast cancer survival. And these are studies from China and from the US. So they're showing that the observational data show that soy is beneficial for breast cancer patients. The clinical studies are extremely supportive of safety. They're not supportive of benefit, but they're supportive of safety. So you can look at markers of breast cancer risk, like breast cell proliferation, which I mentioned during the presentation. No effects of large amounts of isoflavones on breast cell proliferation. In response to combined hormone therapy, estrogen plus progesterone, you get a 4 to 10-fold increase in breast cell proliferation within just a matter of weeks. No effects of isoflavones. No effects of isoflavones